Hey babies, welcome to Donna's Spot with me, Donna. And to anybody in the Western New York area, although I'm in Buffalo, New York, apply for the high blood pressure study at ECMC. And this is what a study would look like. You'll get the title of the study, and a little synopsis of who's sponsoring the study, and the protocol number, and the investigator, and a telephone number, address, and then an introduction. Now, when you go to apply for a study and you contact them for this study, it is at ECMC, Erie County Medical Center. And the person that is accepting applications into the study is Peter Osmond, and his phone number is 716-85485. That is for the high blood pressure study, the David K. Miller Building on the ECMC property. All people will have to go to the main hospital and go through the main hospital because of the study is a long study, so that's good. And it's measuring people that have high blood pressure, whether controlled is using medication, or uncontrolled. These people are good people. I'm not just saying it to say it. I've been dealing with this study component of people for the last 21 years, and they have kept me alive. I like them. They're attentive. They hear what you say, and they advise what's best for you. The study doctor, Joseph, is a renowned specialist that's all the way around the world trying to find medications that are good for everybody and that will help you to keep your pressures low. Dr. Izzo is very attentive to his patients in his study. I don't care what's going on, he wants of it. He will allow you to get in his studies. He will treat you with the medication or placebo. In any study that you involve yourself in, you will always get a placebo that you're taking for a while, and then later on you'll get the medication. Sometimes you'll get the medication for a while, and then you'll get the placebo. Nobody knows. I don't know as the patient, and Dr. Izzo, Kelly, or Pete doesn't know as the provider. We just know that we're going to get the medication. Either way, you're going to get the medication, but when you're going to get it, you don't know. But everybody in the study will be able to experience the medication. And the study, who put the study together, they do it that way. So nobody say, oh, well, I got this or I got that. You know, they don't want you to know. They just want to see how it works with your system, because everybody's system is different. This study that they are having, first of all, you get like a contract packet, and you want to know who your primary care doctor is. And they'll listen to you and all the ailments that you have and all the medications that you have. And they will take blood pressures with a monitor, an electronic monitor, and take multitudes of pressures. If your pressures fall within a range, and I do not know what the number range is, then you will be able to proceed with the study. if your pressure is high, like mine tends to be, they will still take my pressures, and if it's too high, they will still give me all the information about the study, send me home, and have me come in about a week or two. I tend to have like 190 over whatever. They know why, and I know why. So it's not scary as it would be for a new person who didn't know they had high blood pressure. Now, within this study, you have different study groups that you fall into, and that's only how the study goes. So you got two different study groups. One is period 1, and you will receive either the study medicine or the placebo for 12 weeks. And then period 2, you will receive an open label study treatment for 24 weeks. In period 3, your 200 subjects that will continue past period 3 and receive open label study medicine for another 12 weeks. It's a luck of the draw what you get. I don't know what I get. I'm not at the study. And the package tells you what they're looking for and stuff. Honestly, personally, I've read the whole contract of a study. I know what I'm looking for, and once I see what I'm looking for, then I know if I'm going to get into it or not. The study consists of 6 weeks, periods 1, 2, and 3, and possibly plus 12 weeks. When I'm looking for it, I'm seeing the time commitment in months, weeks, or days, and I'm seeing the payment amount. That's all I'm looking for. I'm signing the paper, and I'm doing what I gotta do. They want you to sign this paperwork so they can have constant communication with your primary doctor. So therefore, if you're having problems or you're having an allergic reaction, yes, they will assign specialists and different things to help you that's further along than Dr. Izzo. And if you need an operation or whatever, he'll, talk with your primary doctor and make the decision. But what I like about Dr. Izzo is whether you have insurance or not, you qualify. When I met Dr. Izzo in 2001, my pressure was like 190 over 160 something. I was really in trouble. And I did one of his studies, and he provided me medication and everything. And when I got out of his study, I still didn't have insurance. Because a lot of people think that you automatically qualify for Medicaid. That's not true. So it's a lot of people that are considered as working poor, and you work maybe say through a temp service. And if you work through a temp service, you're going to get money, but you're going to have a hard choice. It's either try to pay for some insurance through them or try to pay your bills. And at the time, I had me, my son in the house. So I had to pay my bills. So I didn't have insurance. And they kept me with medication. So this is why I said these people are good people to work with and deal with. Anywho, with this study, you will have a number of visits. And they do provide transportation for you. So that's a great thing for me right there, the transportation. They'll call a cab, pick me up, take me to the hospital, whatever I got to do in the study, call the cab, and bring me home. And they pay for the cab, not me. So that's a great thing. And then with, you'll get different tests like angiogram and different tests, and you'll have to give blood and stuff. This study pays others, and that's considered for your transportation and the time you go there and spend. Your days, your regular visits are $100 a piece, and when you have to do more, like go get blood and where the high blood pressure harness, where they put the high blood pressure cuff on you, and you got to wear a monitor, you get $150 for those days. It's 2 times that you do that within the study. I just did it yesterday. I went yesterday. They put me on this for the high blood pressure. Had a little box connected to it where it measures your high blood pressure throughout the night. You could take it off for a short amount of time to wash or take a shower or whatever, or take a bath. And then when you get out and get yourself together and get dressed, you have to put it back on. And then 24 hours from the time you leave ECMC, you will be back at ECMC the next day for them to take it off. And then that's when they do the electrocardiogram, and they do other tests to make sure you're healthy. And I think that's a good thing. So they gave me medication, as you see a lot. And I'm supposed to take 2 pills a day. Trying to get this open, so I don't know why I use my left hand. I'm right handed. But I'm to take 2 pills a day. Finally could get it open. Wow. You take 2 every day, and this is the medication. And you take your medication every day. Then when you're scheduled to go back to them, of course, you take your bag and your medication. When I first started to study, I had to fill out a pamphlet with the name of my medication that I take for high blood pressure every day and the time period. And that worked for me. So I'm on my 2nd/3rd visit. And the reason I say 2nd/3rd visit is because when I first went, my pressures was high. So I had to come back for another visit. And I got it. And then after that, next visit was yesterday when I had the harness. But it's a good program. And if you quick money and it's not taxable, anytime you do a study money is not taxable. That's a non-taxable income. So if you're working, you do not have to claim it on your taxes. Although if you make more than $600, they will send a tax form to the government, but you do not pay taxes on money from a medical study because you're doing whatever you need to do to help take care of yourself so you won't get sick. And that's all to it. So if you want to make you some money and you got high blood pressure, I would advise for you to call them. I will give you the number. Their address is 462 Grider Street. I will link it down below for ECMC and the address and, zip and all that. I'll put the phone number down. I'll put the person's name down, Pete, and just let them know Donna Howard sent you. And it's not like it's a referral. I'm giving you a referral to get. Doesn't matter if you got a referral, no, but they always want to know where you get the phone number from. So I'm telling you, Donna P. Howard, I'm giving you a referral to get in a high blood pressure study. When I first went, it was December 7th and Christmas Eve, December 24th. I had my first check for $100. Your checks are good for. So if you can get in there and do your study. Every time you go for a visit, you get money. Now, how long it takes for you, I guess it depends on whoever is processing it. It's kind of like University in New York or something like that. So it depends on how fast they process it. But the money is good money. And I guess if you would like to have it all at once, because some studies, that's how they pay. And that's what I was thinking now. I was going to get to 1,100 at once. Because, you know, it's easier to do something with 1,100 than it is do something with 100. But in the same instance, you can always cash that check and put it in your checking account or savings account or under your mattress or however you say your money, save it up for 1,100. Or that could be your little spending money, you know, because you still got your income, whatever it is. So this is just like your extra money. So you could save it on your own, or you could talk to them about issuing it to you all at once, I would assume. I would have did that. I was expecting it to be issued all at once, but hey, they're going to give it to me every visit, you know, shortly after my visit, you get your money. Hey, sometimes it's nice to have that extra pocket money because I got my income, whatever it is. So I like to have a little pocket money along the way. I can save my own money. So it is what it is. But I hope you take an opportunity to get involved with this, to get you some extra money, to maybe find a blood pressure medicine that works better for you than what you're already taking. And if not, at the end of the study, if it's not working better, you can always go back to your regular medicine. So this is just me giving a gift to you because, you know, resources is my thing. I love to do all kinds of things to get extra money. That's where you always see me say fruits of labor when I'm shopping from that money. And I just want it with you. I do all kinds of medical studies. That's my thing. I do medical studies. I get my own money so I don't have to have nothing. And don't want nobody asking me for nothing. And I'm good. So until next time, I'll see you later. Please subscribe and hit that notification button so you'll always know when I'm uploading. Plus it shows YouTube algorithms that you like these type of videos and you want me to keep doing it. So therefore they'll show my videos to other people and we can have more people in our family at DONNA'S. If you interact with me, if you ask me a question or make a statement, I will get back to you. I can't promise you it'll be the same day or the same hour, the same minute, but I can say I enjoy interacting with my followers and I will get back to you. And if you're on other platforms like Facebook or Twitter or Instagram, I'm there too. I'm on Facebook under Donna P. Howard. I'm on Twitter under Starlight529 with a capital S. I'm on Instagram with the name Starlight529 with a small s. So you're always able to interact with me, and I will interact with you on any. You can friend request me if you want. I will accept your friend request, and let's get this money. So until next time, I'm going to see you later. Love you.